Depending on how an interview is conducted, clients can hear themselves speaking in one of two ways. They can either hear themselves articulating desires, needs, and reasons for change, or they can hear themselves arguing against change in favor of the status quo. Motivational interviewing involves making choices about what to reflect back to clients in order to fortify their thinking about, and in fact their talking about, a need for and a commitment to change. In this way, MI can be understood as a strategic form of listening and reflecting. The strategy in this interview involves listening the client into yes, or into a decision to pursue better self-management in his diabetes care. This brief video demonstrates the power of clients hearing themselves speak, particularly hearing the evolving argument that begins to form as the interviewer helps clients to explore the benefits of pursuing particular changes. People often need a chance to be listened to. It enables them to hear themselves think out loud. Paul is a person who clearly needs help to hear himself form his own argument for change. The interviewer here uses a range of MI skills to help the client construct a commitment for improved diabetes self-care. MI work involves using a variety of skills to move in and out of 4 primary change-enhancing processes. Of the 4, it's important, particularly with new patients, to set the foundation for a collaborative working relationship, which begins with the first process of engaging. Initially, the interviewer must engage with the patient's perspective and logical take on the issue that's being discussed. Engaging with the patient's thinking gives them reason to trust that they're being heard and that the priority for the interviewer is to seek clear understanding. Patients are more likely to become open to engaging with new ideas and new ways of thinking about their situation a little later on in the discussion, when they know that the interviewer has a desire to understand and not just to be understood. In the opening moments of this conversation, notice how the interviewer makes extensive use of reflection to engage with the client and his thinking.
So, Paul, why don't you tell me a little bit about what brings you into my office today?
Well, I've been a patient of Dr. Blackwell's across the hall there, and for about 3 years, I guess now. He calls it diabetes. I'm not sure I'm a full-blown diabetic. You know, I have blood sugar problems. Sometimes my blood sugar is kind of normal, but he's been having me on pills mostly. Those little white ones with the line through them, you know, the metformins. And then there's these other little white ones, the long and skinny ones, that do something with your pancreas to make you make more sugar or insulin and all that. But he's saying they're not working that great right now, and he wants me to start using that pen thing to inject yourself with, you know, the full-blown stuff, right? And he's also on my case about my weight and about exercise. You know, he's saying weight loss and exercise, and you know, that has to get looked at and whatnot. And now my blood pressure is starting to go north a bit and stuff. So anyway, I think he wanted me to see you because I think you're supposed to give me a good talking to. He said, I think it's time for a good talking to. Obviously what I'm doing is not working, so your job is to give me a good talking to. So good luck to you.
So you're not so sure. Sounds like you're really not so sure that that's what you need. What do you feel like you need?
Well, I agree with him. I need to lose weight. I know that because even he has said if I could lose 60 pounds, there's a good chance I wouldn't be a diabetic anymore. And I think that's the main problem is Patients can form arguments both for and against almost any recommended change. In this interview, Paul needs to hear both sides of his own thinking before he becomes willing to start using insulin. It's common in MI interviews to begin with having the client argue the no side of the argument that's connected to the targeted change. When they begin on the no change side of the argument, clients are likely to run across contradictions in their logic and in their thinking, which allows for helpful movement into the pro-change side of the discussion. In this way, it's usually the patient and not the interviewer who introduces the side of the discussion that would favor the specific change that's connected to the target for the interview. While actively working within the engaging process, the diabetes educator does not argue about Paul's tentative use of the word diabetes. Instead, she works to understand the client's point of view and engages him in a helpful conversation about self-care. At a later time, or possibly even in a future discussion, the interviewer may elect to return to a discussion about Paul's diagnosis and the terminology associated with it. For now, however, it's obvious that becoming sidetracked into an argument about the use of the word diabetes would not be helpful to the purpose of this session. Facilitating Paul's commitment to better use of his medication is more important at this point than arguing over the use of the term diabetes.
I don't really agree that I am a diabetic. I think I'm a person that has blood sugar issues because of my weight, largely. And I feel if I could just lose some weight, that would be good. I know I'm having trouble with that.
So that's something, the losing weight is something that you really kind of feel strongly about, that you recognize that you'd like to make some progress in that area, and you know that might affect your blood sugar and all of these things that are following from this diabetes